We use digital media a lot. It is the single fastest growing part of our business, and I suspect across the board. The challenges in terms of the world we live in terms of communicating with healthcare professionals, is really a lot to do with access and the way that we can develop new relationships with physicians and create experiences for them in ways that we've not been able to do before, and clearly digital is the prime facilitator of that engagement. So we look at trying to provide these sort of holistic experiences built around the brands, where it's no longer enough just to go in and talk about efficacy and tolerability in the drug's delivery system, because you simply don't have time. So you have to engage the doctor quickly. You need to get in front of them. You know, if you happen to meet a sales rep, he knows he or she knows they've got to get their message across in 120 seconds is about all the time you're going to give them. So it's clearly a high pressure, condensed kind of atmosphere in terms of it compounding the 5,000 messages that physicians are going to see, because they're also human beings. I guess it just makes things more complicated. So we look for ways of introducing simplicity. Constantly comes up, despite everything else being technically complicated. The ultimate result must be the delivery of some very simple messages, because there simply isn't time to do anything else. To use an example, if you can show a physician, you can tell a physician anything you like, I mean, within reason and within code and anything the lawyers will allow you to say, but essentially if you can show a physician a piece of video or something to do with a patient, something to do with empowerment of their lifestyle by the facilitation of a good medical practice, it's very powerful, you know, it's very moving, it can be emotively rich, and so I think we look for video to add that kind of contextual piece to it, whereas data sometimes leaves you feeling very cold. Video can make you feel very, very warm and very disposed towards something. Cannes a big deal, let's be clear about that. There was a lot of conjecture amongst my colleagues, a lot of the other creative directors some were concerned that the peeling off of healthcare was seen as not a good thing, because it was like, if it's good enough to win at Cannes, it should be at Cannes. And then of course there's the other school of thought, which I guess is the more pervasive one amongst healthcare people, that this is just a very different animal. This is a very different beast. We have to do things in a different way. And I guess over the last year I've been thinking more and more that healthcare has to find its own way. You can take examples from Land Rover and Starbucks and Sony and Apple and use all of those analogous situations, except they don't really fit in healthcare. Healthcare has to find its own solutions. Therefore, something like Cannes makes a lot of sense. Okay, so there's a need for Cannes. So we're all going to go to Cannes next week or 2 weeks' time, and talk about things that we don't get to talk about a lot. The idea that what are the new communication paradigms that are existing? How is this all evolving at once? I think very few people have their hands around the whole mess. You know, 85% of people think healthcare is going to continue to evolve at a very rapid rate. So that means the communication of healthcare is also going to keep evolving, and that are we at the trailing edge or the leading edge? I'm never quite sure. I think digital is going to play a greater and greater role. I think the need for ideas has never been greater. The facility with which to deliver them and the aptitude and the amplitude within the market to deliver them has never been greater. So it's clearly a time of tremendous opportunity if you can step away from the regulatory handcuffs, and if you can find a way around some of the things that tend to be very confining. So it's going to be an interesting time. I think if this festival creates as much conversation as I hope it will amongst the groups of people that attend, and clearly has to have a strong contingent of clients there, then it really will be a great success.